people hear about OCD, they often think that it's just about being neat, clean, tidy, and liking things organized and in a planned way. But obsessive compulsive disorder is much more than that. It is about those unwanted thoughts, the intrusive thoughts that come to people's mind. And although they don't like it, they don't want it, they keep coming back to them. And that causes an intense anxiety in the individual. And they do rituals or repetitive behaviors to get rid of this anxiety. But the anxiety doesn't go away and this keeps coming back. So those thoughts that keep coming are called as obsessions, and the acts that people do to avoid them or to get rid of the anxiety are the compulsions. And that makes it an obsessive compulsive disorder when it impacts on people's personal, occupational, and social functioning. If you only have some obsessions, that is, the thoughts coming to you, you don't want them, and they repeatedly come to you, they are the obsessive rituals. But then when they have the compulsions associated with that and impacting on your life, then it becomes an obsessive compulsive disorder. It is not a personality quirk. It is a real anxiety disorder that impacts deeply to people's lives. It impacts your personal functioning. It impacts your familial functioning, your social functioning, and occupational lifestyle. There is a method to the diagnosis of this. There is a proper diagnosis that can be done. There are evidence-based treatments available, including therapy and medication. And timely diagnosis can help to get the relief on this. Some of the symptoms on this condition, apart from the rituals that happens, is dependent on what type of obsessional thoughts people are getting. If they are about being tidy, being clean, that can be one sort of obsessions that come to people's mind. But it might be many other things, like some people have got only the ruminations of some numbers or some calculations that goes on in their minds. And unless they have overcome that calculation or number counting, they can't move forward. That are also obsessional ruminations. And when people start to act on them, then it is the compulsive component that makes it an obsessive compulsive disorder. People have got many other thoughts and intrusive thoughts. They can be obsessions. So we give examples when people are going to the job. They get up in the morning and want to go to the facilities and get ready for the jobs. But it takes long time for them spending in the washroom, for example, because they are not clean. They have to clean themselves. And actually, it is not about cleaning themselves. It is about that thought that comes on a repeated basis that they have to overcome because they're feeling anxious about being untidy, unclean, and unkempt. They will do these rituals again and again a number of times that take a lot of time for them to go to the jobs, to go to their profession, to the routines that they have to do. That will impact on individuals' functioning as well. And that can be personal functioning, occupational functioning, or their familial life as well. When the assessment is performed, there is a longitudinal history that is gathered. It is very good that people have got family members who are supporting, and then they can give information how it impacts on their livelihoods, how it impacts on their day-to-day functioning. And once the history has been completed by taking the history of presenting illness, the family history, the past psychiatric history, medical history, and personal history, then mental states examination can be conducted to establish the obsessions and compulsions which are present. Sometimes people get quite distressed about this and get quite anxious. And we have to distinguish this from something like a panic attack or panic disorder and an obsessive compulsive disorder. Sometimes also it is quite easy to diagnose this condition, but difficult to treat. Again, as in mental health, biopsychosocial approach is the one to go. There is medication treatment available, psychological help, and also there is the social side of things which are very important. Individuals who have got the options of taking medications can respond really well to medication. But the best evidence available is for the biopsychosocial approach. And when people can be treated with the help of medication and psychological help, the outcomes are better. There is help available. If you're concerned about yourself or the family members, it is always good to ask for a professional help and get an assessment done so that the diagnosis can be achieved early and the treatment becomes easier for the long term. Obsessive compulsive disorder is not a very difficult condition to diagnose. If it is early, the treatment becomes easier as well. But as you leave it for a long time, the condition can worsen and also become difficult to treat over the long term. So timely detection, assessment, and diagnosis and treatment are helpful.